You'll find it. We have the Administrative Director of Addiction Services with Pine Grove Behavioral Health, Russ Rainey, joining us now. Russ, how you doing today, man?
Doing great, Uncle Dave. How's it going?
Not bad at all. And I think it's fitting because it is Halloween weekend coming up, and we've got some scary stuff to talk about, including a relatively new development regarding Narcan. And some of the other emergency drugs for use with a drug overdose. We'll get to that in a minute. But first, let's hit the basics. The epidemic, the opioid epidemic that we have heard so much about for a year or two. From your perspective on the treatment side of things, how is that going? Is it getting better, worse, about the same? Where are we at?
Well, it's hard to say given the pandemic. The numbers are still coming in, but one thing we can see from the trends from years past was that in 2017 things seemed to peak, and so we saw it slightly decline in 2018. But what we do know is that just following trends here in Mississippi, we're no different. About 60 to 70% of those overdose-related deaths are opiate-related. So, man, it's still a beast. It's still out there kicking butt and taking names. That's why we're out here in the trenches trying to hold things together.
Now, what would it be a significant percentage of those that are abuse related to prescription drugs, or is this more of a street drug problem?
Well, it's complicated, like most things, right? I like to say the truth resists simplicity, but what we saw in the late 90s, the early 2000s was this great increase in people writing scripts all the time, right? And I think somebody said at one point, early on in the OxyContin days and writing prescriptions, that there would be enough bottles if every man, woman, and child in the United States, there was enough prescriptions available for every person to have their own bottles. So, obviously that had been a problem for so long, but when we started cracking down on that, and the jury's still out on how effective that stuff was, but when we started cracking down, what happens was when these prescription drugs are harder to obtain due to cost or lack of insurance or whatever, people are going to seek that somewhere else because they become physically dependent on that medication. And so then we started to see, soccer moms be addicted to heroin. And now with the ever fatal fentanyl that's way easier to produce, right? And being cut with other drugs, man, illicit drugs and the overdose they're causing is a complete disaster.
And that's part of the problem with fentanyl, is that it is so potent and so deadly that it doesn't take very much of that at all mixed in with something that you think is okay, even though it's not, but you think it is, to end your life. It's just that simple, and there's no way really for a user to detect it before they take it. So you're running a risk every single time, right?
Correct, man. It's like playing Russian roulette out there in the street, man. It takes very little, like you said, of that drug, and people not knowing what's in, when other drug, methamphetamine or other street drug, heroin. They don't know how much fentanyl has been cut in that substance, and so it can be tremendously fatal. And man, we see it just right here in our area, man. I could give you the anecdotal evidence of half a dozen people that I know or am familiar with, either directly or indirectly, that have lost their lives during this past year. It's completely tragic.
Well, and the problem is when we talk about this, a lot of times we forget when we're discussing overdose deaths, whether it be opioid or whatever, that's the end of a process. Very rarely is that, tried it one time and it went poorly. That does happen, but not that often. Most of the time, it's after months or years of addiction. And that means a lot of this is avoidable, Russ, if somebody would just take the steps to help people through that. Would you agree? And what would people need to look for in their friends and family and coworkers as some signs that maybe somebody needs just a helping hand?
When we start looking at substance use disorders, what we call it, obviously it ranges from mild to moderate to severe, but you start looking at the consequences people are racking up in their lives. Is it starting to impact their school life or their work life or home life? Are we continuing using despite these negative consequences? And when we identify that with somebody in our lives, and I mean, we've all been touched by it. I've got people in my own life who I've noticed this in and had to say, hey, you want to take a look at this? Not in a shameful or a calling out way or like, hey man, you're just not don't have your stuff together, but it's just like, hey, I see things kind of coming off the rails here, and I want to help. If any of those indicators are things that we start to look for when somebody might need some intervention.
And I think you made the perfect point there. It's not from a position of accusation. It's not from, what's wrong with you? That's exactly the wrong attitude to take to help someone, because they're immediately going to close off and shut down. And you're not getting into help at all then. You have to approach it from a much more gentle way, a much more accessible way that allows them to respond, no matter what your first impression may be or your first reaction may be to it. And it can be just as easy and just as simple as what you just said, I would think. Just say, hey, what's going on? Come on, sit down. Let's have a talk. What's happening? What's happening, man? And you just go forward from there.
Correct. Look, we've stigmatized this for so long, and the stigma's been so deep. But somebody said it like this one time: addiction, sobriety is not the opposite of addiction. Connection is the opposite of addiction. And so, I don't want to get into knee deep of policy and stuff like that, but we penalize a lot of these people when we know drug court works. We want to offer people connection. We don't want to cut them off from the things that give them life, right? And so they have a brain disease. And so what we say is, hey, with any disease, it's not your fault maybe, but it is your problem, right? We get sick on accident, but we get better on purpose. And so, hey, come join me in this thing to try to figure out how to connect again so that you can live the best life that you've been called to live.
Would you think it's a fair statement to say that more likely than not, the first time you have that conversation, it's not going to work? It's going to take continued attention?
Yeah, of course, man. Look, we're all human and we all make mistakes. We all have choices to make, but, we don't like being called out on our junk, but we all need somebody in our life that's not going to co-sign on our bull. You know what I mean? That's not going to say, hey, I'm going to let you continue down the road that you're going down.
Hold on. I got to write that down. I'm stealing that. I'm stealing that, Russ. I'm going to use that. That's great. I'm not going to co-sign on your bull. That's perfect. Right.
You got to have somebody in your life that's not going to sign off on it.
That is fantastic, and that we've had a lot of terms for that over the years. Tough love, things like that. But you have to do it in a way that gives them the opportunity to accept the help that you're offering, because a lot of times it can be phrased in such a way, it can be done in such a way, whether it's body language, facial expression, tone of voice, the words you use, that makes them immediately slam that door and they want nothing to do with you. And that's why this is so tricky, and that's why professionals like you exist, because this is not as simple a process as looking at somebody and going, hey, knock that off. It doesn't work that way.
Yeah, hey man, at Pine Grove, this is what we tell people. This is a place of love, care, and compassion. You can feel like you're in a safe place to heal. I mean, dude, you've been drugged through the mud long enough by your addiction, by other people that have been intolerant of that addiction, and maybe understandably so. But here, we're caring professionals, and we want to walk with you through this process.
You got something on the C Spire text line. Ken says it's the fault of bad decisions. Yes. 100% yes. Bad decisions shouldn't control the rest of your life, though, and that's kind of what we're talking about here. It's Russ Rainey, Administrative Director of Addiction Services with Pine Grove Behavioral Health. We're up against a break. Can you stick around through the break? We still have to talk about Narcan and what has both of my eyebrows went up when I heard this one, Russ. Can you stick around?
Let's do it.
Fantastic. Russ Rainey, we will continue with him on middays on SuperTalk. Here, Russ Rainey on the show with us, Administrative Director of Addiction Services for Pine Grove Behavioral Health. And I want to get into this because it was a story a year or two back that law enforcement were being equipped with Narcan, naloxone, the crash drugs, I guess you would call it, the crash treatments for those that were going through a drug overdose to save their life. And now there's been a little change in the whole Narcan situation, not from the willingness of law enforcement, not from the willingness of anybody to get it done, but how much did the price increase, Russ?
Oh, well, you're asking a tough question, and I'm not sure I can pinpoint an exact answer for you. All I can really speak to is, our ability at the hospital to be able to get that. And it doesn't seem like even the supply chain issues that we've seen have kept us from getting, our allocated supplies of Narcan. So, and the price increase, according to pharmacists that I've talked to, at least here, don't indicate that they're that much different than they have been in the past.
Okay, so it's more just a problem of getting your hands on it.
Yeah, probably so. We started an initiative way back when, and I think that this was worth mentioning, that anybody that comes here with opiate use disorder, we try to equip them with a prescription for Narcan before they leave here. And so that's just one tool in a toolbox to build their recovery. I mean, obviously that's not the ultimate solution. And the hope is that people won't go back to their drug of choice, right? But it's just that safety net. And I think having law enforcement officers, having first responders have that on them, should they encounter a 911 call or need to respond to somebody who's in the act of an overdose. Man, it's been really helpful. I think I read somewhere that it saved upwards of 2,000 lives just in the last year. So, I mean, I think there's definitely some use, and it's got its place.
It's one more tool in the toolbox, just as long as we can keep it flowing. But as we all know, with the supply chain, you don't know from one day to the next what we're going to be running out of. That's the way it feels right now anyway, Russ. So you still have to keep an eye on that. Let me ask you this. As we have come out of the pandemic, and I'm not going to say full normal, but we have gotten close to the way things should be and the way things were pre-pandemic. What are you seeing in terms of your patient levels at Pine Grove? Are they up? Are they down? Are they about where they were? Where are we at?
Well, we've been treating patients all throughout the pandemic, following all the CDC's protocols and all the things being associated with a major hospital. We followed all the protocols and been really careful about, bringing COVID here, because this is a residential treatment facility. I mean, people come here to live and receive treatment. And so, we want to make sure that our current patients are safe and the ones that we're bringing in are healthy for the community. But we haven't stopped treating patients in the last 20 months. But I think through all of that, our numbers have maintained. I think having that availability and putting the word out that there is a place to come, there is a safe place to be, where people want to be in your corner. We all need somebody in our corner, and we want to be in your corner. We want to help walk you through this road to recovery. And so our numbers have pretty much held steady. We haven't seen any decline. I think early on, we have gender specific programs. We have a program that caters particularly to older adults. And so if you remember early in the pandemic, we didn't know anything back in the first days. It was like, we know it affects older adults, right? So we did taper off in our older adult program for a little while, but as soon as we started opening things up after that first wave, people started coming in droves, man, just because again, people are suffering. Addiction is a disease that thrives in isolation. And the pandemic, what did it create? It created all this isolation, right? And so again, just like we said earlier, the requirement is a reconnection with people and resources that you need to take the next right step. And we've all had difficulties during the pandemic, but we've managed, thankfully, over the last month.
Now, let me ask you this. Got a text on the C Spire text line. Gary in Meridian says, agreed that we need to be compassionate to those addicted and seeking help. What do you do for the person who has been through various rehabilitation programs numerous times? What's the limit? I think, and I don't want to put words in Gary's mouth, it sounds like at what point do you just wash your hands of it and say, okay, nothing's going to happen? And I think this kind of ties into a question I was going to ask. The person getting the help has to want the help, or it's not going to work a lot of times, right?
I mean, that's correct, man. I'm going into my 18th year of doing this work, right? Particularly working with drug addicts. And so people come into this experience and they enter into services in a lot of different ways, man. Some of them are broken and they say, hey, man, I'm at my bottom. Some of them hit rock bottom and they got out their shovel and they kept digging, right? that load just wasn't low enough. And so we see these, we talk about chronic relapse. And I mean, the disease of addiction is a relapsing disease, right? And so, the question is, when do we wash our hands of people, man? I'm not in a moral place to make that call. I mean, I think that individuals are all created in an image and they're worthy. And, I mean, we can talk about politics and we can talk about, how we need to address these things on a societal level. But man, I'm focused on individuals that are sitting in front of me right now. What have they missed in these last experiences? What resources were they not able to connect with? What social supports were they lacking that we might can start addressing next? And so, look, man, I don't want to sit in judgment of anybody. I just want to help the next dude, the next lady that's struggling.
And I'm going to speak to that for a second because you're exactly right. But to me, is there a limit? In my mind, no. And here's why. We have story after story of people who failed and failed and failed and failed at all sorts of things. And, well, if they had given up after a few, they wouldn't have had that success. Probably the biggest one has nothing to do with any of this, J.K. Rowling and the Harry Potter books. It was the 45th person that she submitted it to that decided to publish it. The first 44 said, no, this is horrible. We want nothing to do with this. She now has more money than the Queen. If she had given up after 20, she would still be waiting tables. So the concept of what is the limit, I don't think there should be a limit on trying to help people. But that's just me.
Well, we have a saying in recovery. We say, don't give up 5 minutes before the miracle happens. Right? And because it speaks to that principle that you just talked about. I mean, thank God for 10th, 12th, 15th chances, because I've met some people that wouldn't have been alive if it weren't for them. So, man, again, I don't want to sit in judgment about how much is too much. And, again, we just encourage people not to give up 5 minutes for the miracle happens.
If you had time to give one piece of advice to someone who has a family member, has a friend or someone they're close to, that they know they're going through this, they can tell that they're having problems, what one piece of advice would you give them on how to deal with it and how to help?
Man, one of the biggest pieces of advice that I give family members all the time, because I am a family member, right? I identify with them. One of the things I say, start with yourself. Start with getting help for yourself. Get into therapy. Find a therapist that you can work with on an outpatient basis. But the biggest message is, again, just don't give up hope. Let's all work together to reduce the stigma. Let's figure out ways that we can connect people instead of keep people apart. And just again, don't give up. Don't give up. Don't ever give up. Because I've seen people give up. And I'll tell you, I've heard some really sad stories, but what's even better, Dave? I've heard some redemption stories too. And those are a lot more exciting.
They're a lot more fun to think about, and that's the ones that make it worth it. That's the ones that make it worth it, that fight through, get through things, get help, get back up, have support, and 5-10 years down the road, I got a good job, living in a nice house, living a good life. It happens, doesn't it?
The big book says if we're painstaking about this phase of our development, then we'll be amazed before halfway through. I've seen it happen too often. And so that's my encouragement to everybody out there, man. If you're struggling today, just reach out. You're talking about alumni. We have an alumni program, man. People come back to tell their story to other people that are sick and suffering. And so, man, we see it work. We know it works. Reach out to us.
Russ Rainey with Pine Grove Behavioral Health. Enjoyed it, man. Take care of yourself and keep going the way you're going, all right?
Thanks a lot, brother. Appreciate it.
Talk to you again soon. Always enjoy talking to Russ. We're up against a break right now.